Good day everyone, my name is Ayodele Olamide. I'm here to present my Unit 18 assessment on health promotion. Understanding health promotion, models, initiatives and public health impacts. Moving on to the next slide is my introduction. Health promotion definition. It's a process of enabling people to increase control over and improve their health. Intel citation WHO 2016. Focus on prevention rather than treatment. Works at individual, community, and population level. Intel citation Scriven 2017. Structure. Process of enabling people to increase control over and improve their health. This was cited by the WHO 2016. Focus on prevention rather than treatment. Works at individual, community, and population level. Intel citation Scriven 2019. By the end, you should understand some different health promotion models, look at a real campaign example, and know how organizations try to improve public health. What actually is health promotion? Definition of health promotion. Health promotion is about preventing diseases and helping people stay healthy. It does this through teaching people, making environments better, and making it easier for people to make healthy choices. This was cited by Needle and Wills 2016. Main ideas. Firstly, I will look at some health promotion model. Then I will talk about NHS Better Health Campaign. Finally, I will discuss what Public Health England does. Why it is important. Now, by the end, you should understand some different health promotion models. Look at a real campaign example and know how organizations try to improve public health. Overview of health promotion models. Models are basically frameworks that help us understand how to change people's health behaviors. They give us structured ways to plan health programs. Intel citation Newbeam and Harris 2019. There are different types of health promotion models. We have individual models, community models, and population models. Starting with individual models. These focus on what individual people think and feel. Community models. These look at social influences and the environment. Population model. These think about how policies and risk system changes. Why model is important? They help predict what might actually work. They give structure when planning health programs. They make it easier to work out if programs are successful. They help us understand why people behave the way they do. How to believe model. How it is supposed to work. People will take action about their health when they think they are at risk. The problem is serious. Doing something will help, and the barriers aren't too big. Intel citation Champion and Skinner 2008. Main parts. Perceived susceptibility. How likely someone thinks they are to get a particular illness. Perceived benefits. What they think they will get out of taking action. Perceived severity. How serious they think the illness will be if they got it. Perceived barriers. They might stop them from taking action. Perceived barriers are things that might stop them from taking actions. Example, breast cancer screening campaign that talks about risks and benefits. Vaccination programs that try to deal with people's worry about side effects. Anti-smoking campaign that talks about health risks and benefits of quitting. Social cognitive theory. There are three main parts. Personal factors, things like knowledge, skills, emotions, and biology. Environmental factors, things like family support, peer pressure, and community resources. Behavior, what people actually do. These three things constantly affect each other. Intel citation Bandura 1986. Examples, diabetes programs that teach that teach skills while also providing family support. exercise programs that build confidence through doing things in group, stop smoking programs with peer support and learning coping skill. Self-efficacy. This means how confident you are that you can actually do something successfully. People with high self-efficacy try harder and don't give up easily. You can improve it by watching other people succeed, getting encouragement and managing stress better. Moving on to the next slide. Comparing these two models, which is the health belief model and social cognitive theory. Both focuses on changing individual behavior. Both think, beliefs, and what people think are important. Both recognize there are barriers to change. Both are used quite a lot in health promotion. Health belief model mainly focuses on what individual thinks, assumes people make logical decisions, doesn't pay much attention to the environment, works well for one-time behavior like screening. Social cognitive theory includes social and environmental factors, emphasizes learning by watching others. Self-efficacy or confidence is really important, better for long-term behavioral changes. How good are this model? Health belief model. Strength. It's simple and practical to use. Good at predicting if people will use health service. Lot of research has been done on it. Works well for screening and vaccination program. Weakness. Assumes people are always logical, which they are not. Ignores social and environmental influences. Better for short-term than long-term changes. Might not work well in a different culture. Social cognitive theory. Strength. Takes a comprehensive approach, including the environment. Self-efficacy is really good at predicting change. Flexible for different groups of people. Good for complex behavior. Weakness. It is quite complex with lots of different parts. Needs a lot of resources. Can be overwhelming to actually implement. Not much evidence for some parts of it. NHS Better Health Campaign. What the campaign is. Better Health. Let's Do This started in September 2020 by Public Health England. It aims to help adults lose weight, quit smoking, drink less alcohol, and be more active by using digital tools and media advertising. Intel citation, Department of Health and Social Care 2020. Why I picked this campaign? It deals with major UK, that is the United Kingdom health programs. 67% of adults are overweight. It uses modern technology like apps and social media. It's tried to tackle multiple behavior at once. It's a big government thing with measurable results. Who it's aimed at? Primary target. Adults age 18 to 65 in England who are overweight, smoke, drink too much, or don't exercise enough. Secondary target. Healthcare professionals, employers, community organizations special focus. Deprived areas, ethnic minorities, middle-aged adults who are at high risk. What the campaign wants to achieve: support millions of adults to lose weight, quit smoking, drink less, and be more active, reduce risks of heart disease, diabetes, and cancer. This was cited by the Department of Health and Social Care 2020. Short-term goal, between 0 to 6 months. Make more people aware of the link between lifestyle and health. Get 5 million app download and 10 million website visits. 20% increase in people using NHS Stop Smoking service. Medium-term goal, between 6 to 18 months. Change people's attitude towards healthy behavior. Improve knowledge about healthy eating and exercise. 15% increase in people signing up for diabetes prevention program. long-term goal between 1 to 5 years. 5 to 10% weight loss maintained for 12 plus months. 2% reduction in smoking rate each year. Less diabetes and heart disease in targeted groups. Reduce health inequalities between different communities. How the campaign actually works. Digital method. Trackers, NHS weight loss plan app with a 12 weeks program. Couch to 5K running app for beginners. Online BMI calculator and alcohol tools. Media campaign. TV adverts during popular show. Radio campaigns on national and local stations. Social media targeting specific group on Facebook, Instagram, and Twitter. Healthcare support. GP referral scheme that links patients to resources. Training nurses to promote tools during healthcare checks. Partnership with pharmacists to provide material and advice. What they needed. £10 million government funding for the launch. 15 staff to manage the campaign. Digital platform that can handle millions of users. Regional coordinator in all the 9 NHS regions. How well did the campaign work? How they measured success. Digital engagement through app downloads, website visits, social media activity, health service use including referrals and program uptake. Behavioral change through what users reported about weight loss and lifestyle. Evidence of positive outcome. 6 million app downloaded in 18 months. Beats the 5 million target. 15 months website visits, 50% higher than they expected. 25% increase in weight management referral. 80% increase in people using 80% increase in people using stop smoking service. 40% of app users said they lost weight after 3 months. Problems they had. Digital divided. Older adults and people in deprived area didn't engage as much. High dropout rate. Only 13% were still active after 6 months. How to reach ethnic minorities and the most at-risk group. What could be better? More personalized content based on what individual need. Offline resources for people who don't have digital access. Better connection with local face-to-face program in communities. Public Health England background. Public Health England background. More personalized content based on what individual needs. Offline resources for people who don't have digital access. Better connection with local face-to-face program in communities. What they do for public health. More personalized content based on what individual needs. Offline resources for people who don't have digital access. Better connection with local face-to-face programs in communities. Main service. National campaign like Better Health and Change for Life. Cancer screening and immunization programs. 24/7 emergency response teams. Health surveillance system and data analysis. Supporting local authorities with public health programs. How PHE actually improve health. Ways they improve health. Disease prevention through early detection and quick outbreak response. Health promotion campaigns that reach millions of people, targeting intervention at communities with the worst health outcome, supporting local NHS and councils with experts and resources. Successful programs they have done. COVID-19 response led the national pandemic response, including test and trace tobacco control. Adult smoking fell from 20 13.2% 2011 to 13.9% 2019. Childhood obesity. Change for life reached 45 million people. 76% reported behavioral changes cancer screening program prevented an estimated 4,500 bowel cancer deaths. Impact on health outcome. National pandemic response, including test and trace tobacco control. Adult smoking fell from 20.2 2011 to 13.9 2019. Who they worked with. NHS England on screening and immunization. Local authorities on health improvement strategies. University on research and evaluation. International agencies on global health securities. Summary. Main things I have learned. Model gives us framework for understanding behavior change. The health belief model focuses on what individuals believe, while social cognitive theory includes environment and confidence. Both have good points and works best in different situations. The Better Health campaign shows how theory works in practice by using principles from both models. Digital technology can reach lots of people, but has challenges with keeping people engaged and being fair to everyone. PHE and UKHSA shows how national organizations turn evidence into large-scale intervention, which help improve health outcome. How theory and practice connect. The campaign used the health belief model by giving people information about risks and social cognitive theory through confidence building app and social support. Success needs both understanding behavior change theory and actually putting it into practice through well-funded organization. My own thoughts. Health promotion needs multiple approaches that works at individual, community, and population level. Health inequality still exists despite lots of effort. So we need to focus on wider social factors. Digital technology gives us opportunity but risks leaving out disadvantaged group. Things to think about for the future. Needs to address digital divides so we don't make inequalities worse. Climate change will create new health promotion challenges. Artificial intelligence might lead us to do more personalized approach. Success depends on dealing with social and economical factors that affect health. We need strong public health system for health security. This is my reference. Thank you.